Hey everyone, today I'll be talking about infective endocarditis. Before starting, I need you to focus on this diagram and understand the layers of heart. The one which is drawn with red is the epi or say the pericardium layer of the heart. The one with blue is the myocardium and the one with black is the endocardium. Now focus on the term endo and itis. The name itself would suggest that it is nothing but inflammation or say infection of the innermost layer of heart, that is endocardium. Question is, what causes this infection or inflammation? If I talk about the etiology, there are certain predisposing factors for these to occur, some of which includes: first, what we have are congenital heart diseases. And if you look at this diagram carefully, here I have shown a congenital heart disease which is nothing but ventricular septal defect. Second, what we can have is that the patient may have a valvular heart disease. In this diagram, what I have shown is a valvular heart disease which is nothing but mitral regurgitation. And third, it can occur in IV drug abuser. So these are some of the predisposing factors. Now, if I talk about the pathogenesis, whenever there are these predisposing factors, they cause an endocardial injury. And whenever there is an endocardial injury, it undergoes healing by fibrin clots. Now, whenever a person having these predisposing factors suffers from bacteremia, that is bacteria in blood or say bacterial infection, which can most commonly be after a dental surgery, then these bacteremia go and bind with these fibrin clots, which in turn leads to formation of infective endocarditis vegetation. And this causes the clinical features. Now, if I talk about the clinical features, they are broadly divided into three parts. First, what we have are features suggestive of bacteremia. And for that, the most common feature we have is fever, which can be associated with chills or ricors. Second, what we need to have is a vascular phenomenon. And vascular phenomenon can include a peripheral or a systemic embolization. And third, what we need to have is an immune complex phenomenon. Now look at this diagram for immune complex phenomenon. Here what we have are red colored painful nodules at the tip of fingers known as the Osler's knot. This is what you can see in immune complex phenomenon. For establishing diagnosis of infective endocarditis, we have something known as the Duke's or say modified Duke's criteria, which says that there should either be two major criteria or there should be one major criteria with three minor criteria, or there should be 5 minor criteria. If I talk about the major criteria, first what we have is a presence of bacterial evidence, and this bacterial evidence you get by a blood culture which should show the typical organisms. Next, what we have is presence of echocardiographic findings. Next, what I talk about are the minor criteria. First, what we will have is a predisposing factor. Second, what we need to have is presence of fever. Third minor criteria involves vascular phenomenon, which I've already discussed in the clinical features. Fourth, what we can have are immune complex or say immunological phenomenon, which also I have discussed in the clinical features. The fifth one is a tricky one, which says that there should be a positive blood culture. Now what you need to remember is that if there is a typical organism present, then that comes under a major criteria. But even if there is no typical organism but presence of some organism, then that would come under minor criteria. So this was about establishing diagnosis of infective endocarditis. Next, what is important is the treatment of infective endocarditis, which obviously includes antibiotics. What you need to remember is that first, what we prefer are penicillin-based antibiotics. For example, amoxicillin or say ampicillin. Now, what you need to remember is that if the patient is allergic to penicillin-based antibiotics, you can use other antibiotics like azithro or clarithromycin or you may go for ceftriaxone or some other antibiotics. So this was all about infective endocarditis. Here is the overview of what I have discussed in this video. If you think this video was helpful, do like this video, share this video, and subscribe to my channel. Thank you.